afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you paused your Sunday afternoon activities to spend time with us. Without further ado, I'll turn it over to our founder, Dr. Randall Maxey.
Good afternoon, everyone, and thank you for joining us. We have a treat for you today. Thank you, Dr. Barbara Davis Stevens. Thank you, Dr. Walks, for joining us. And Dr. Hines is not with us except in spirit. And looking forward to Dr. Lawson joining us. We have an interesting talk today. It goes back to one of the original things that we did on Black Health Trust through one of my best friends, who's an attorney named Daniel Zipzer. And Daniel Zipzer was a lawyer that helped us purchase a hospital. And his nickname was Spartacus. And we used to always debate a lot of things, but he was one of the toughest and smartest men I ever knew. And he introduced me to a friend of his whose name was Steve Krause. And Steve Krause headed up a company. He had made several companies public, and then one called Stamps.com. I don't recall the other one. And he also had a company called Second Opinion Experts. And early on, we formed a relationship with Black Health Trust so we could bring expert doctors to the community to give them information and bring them up to date and do second opinions. Well, that second opinion company morphed into a company that we're going to discuss today, where they use smart medicine and intelligent medicine platform. And I want to discuss that. I have one or two introductory slides. And as a matter of disclosure, that let's go with our first slide, Simon, if you would. I got to give my disclaimers. So the company has a software called Hey Dre, and it's an AI-powered health intelligence for patients as well as medical practices. Next slide. So my confession, if you would, is that do have a commercial relationship with this company. I've been named the Vice President of Medical Affairs and the Deputy Chief Medical Officer. And I make about $1 a month, maybe. Next slide. So I'm going to be very happy to introduce you to a wonderful person that I've recently met. Her name is Joy Hardison Evers. She's an MD and a Master of Public Health. She's the Senior Medical Director of Dre Health. Next slide. So a brief bio of her: she's board certified emergency physician. Now we know that emergency physicians are among the smartest among us. They have to react very quickly. And she is also a healthcare entrepreneur. She's had more than 20 years of experience in clinical care, medical leadership, telemedicine, and digital health innovation. Next slide. So she's had leadership positions. She's been a founder and CEO of Health Topic Clinics, former chief medical officer of Vivance Health Solutions, and she's a former CMO of Avista MD rather, and she also has been an advisor at the Mayo Clinic and also Lovers Health. I told her I'd been to Mayo Clinic many years ago before she was probably born. She's so young. Let's go to the next slide. So she's had a lot of training in telemedicine, clinical workflow, operation, interactive and patient-centered healthcare. She got an MD from Mayo Clinic, College of Medicine, and a Master of Public Health from University of Minnesota. So she's used to that cold weather. Let's go next slide. I'm going to have one or two slides just to show. So what is DRE? What is HeyDRE? It's an AI, which is artificial intelligence assisted health platform. It organizes patient records. It summarizes labs and reports. They have something called a vault. You can put your medical records in it and it'll summarize them for you. It allows for more patient education. God knows we need that. It's not a replacement for physicians. Thank goodness. Next slide. So we know that right now there are a lot of problems with fragmented health records. I get patients every day that have been to 10 hospitals and 49 doctors, and they think I'm going to read all that stuff. We have to have a way to do it. This may address some of that problem. We know that there's not much interoperability if you're on different medical records and different systems. We know that there's a lot of physician burnout from being able to go through this problem, and patients struggle often to understand, especially Black patients. We know. Next slide. So, with all of this, we know that HeyDRE can aggregate hospitals, clinics, labs, and wearables. And we're going to ask Dr. Joy to bring some education to us. Let's go to the last slide, I think. There's a lot of benefits for patients. We'll let her talk about that later. Next slide. And their benefits for health equity. We've all been appalled at how the current administration has dealt with health equity. We don't have good access. So we're hoping that things like HeyDRE can bring us into the 20th century. I'd like to introduce to you, and we'll have questions for her. And we're going to ask her, Dr. Joy Hardison Evers, how she got involved with HeyDRE and what she thinks about some of the issues that we raised about how this can help our community do better with smart medicine. Dr. Hardison Evers, please take the floor.
Thank you so much, Dr. Maxey, for that wonderful introduction. I really appreciate being here and the opportunity to share with you all and hopefully to answer some of your questions. I can give you just a kind of a little bit of a brief background about how I got involved with DRE. Currently, I am the CEO of Healthtopia Clinics. I'm also the founder of that practice, and we are based in San Diego County. We have 4 brick and mortar sites, and our model of care is a little bit different than most. We actually are combining several things under one roof. One is integrative medicine, so taking more of like a prevention focus on health and also using natural remedies when those are appropriate, and then only using more intense treatments like pharmaceuticals and other invasive interventions when absolutely necessary. The other thing that we do is urgent care and primary care all under one roof. And so we're really blending the best of all of those worlds together. It was in that capacity that I was attending a founders conference where I actually met Mohan, the founder, I guess technically the founder of DRE. And we ended up getting into a discussion about where healthcare really needs to go in the future. And there was so much alignment in that conversation between him and I that he invited me to participate in some meetings and learn more about DRE. And that's how I got roped into this wonderful project that we are all working on. And it's very exciting.
Well, thank you so much. That's great. So tell us how this will affect our community in particular. We have a mission that we try to bring vetted health information for the benefit of our communities. So how would DRE fit into that? How do you see that happening?
I really think it gets down to focusing more on precision medicine and less on a generalized approach to medicine, because every individual is unique. You know, we all have different genetic makeups, different backgrounds that affects our DNA, which affects the proteins that we create, which affects how we respond to medications, which also affects how we respond to certain treatments and things like that. And I think that tools like DRE and AI in general is really making it possible for us to do that data crunching in a streamlined way that lets us target therapies to the specific individual based on their individual needs, which I think eliminates a lot of the bias that we see in the practice of medicine today. And so that's number one. And then number two, I think that really Dre can be a great equalizer. It can really bring medicine into the fingertips of all people. It's giving people a tool that really helps them navigate the healthcare system, understand their health conditions in a way that is language that they can understand, not medical jargon. And it's individualized because it's ingesting all of the data that is in existence from the electronic health record for a specific individual rather than just kind of broadly giving general advice.
Thank you. Dr. Barbara Davis-Stevens?
I would like to pick up on that last point that you were making regarding enabling the patient to in a more informed way, participate in the treatment partnership that needs to exist with every patient and provider. What I was sitting here thinking about, though, was I was thinking about charts, and I was thinking about the variability in the quality of the documentation that is present in charts. And I was wondering, I know this is an easy thing for AI to summarize, but in the summarization process, as it was taught how to do all of that, how does it make it possible for the patient to really see, not the trained practitioner, but for the patient to see what has transpired in their care?
I think the answer to that is sort of there's two major components to how we solve that problem. So one is improving the quality of documentation in the first place, which, as you alluded to, there is a lot of variability in documentation. And that's really on us as providers to make sure that we're thorough in our documentation. But as everybody knows, it's becoming increasingly challenging. We are strapped for time. We have to see 3 patients an hour, and then we also have to do all of this typing in the computer. And so leveraging AI to help with ambient listening to really capture a lot of the nuances and details of that conversation between the doctor and the patient. And that also lets the doctor focus more on that relationship with the patient rather than staring into a computer. That can really help improve the level of detail that we get in the documentation that ends up in the electronic health record, number one. So because if the data in the electronic health record isn't good in the first place, then it's sort of garbage in, garbage out, if that makes sense. So number one, making sure we have accurate documentation in the first place. And then number two, Hey Dre really brings like a conversational aspect to discussing health issues. I'm not sure if you've had a chance to pilot the tool, but it really is a platform that is not going to represent things the way that a medical note would, in the way that doctors would be used to seeing. It's really going to explain in a conversational tone and voice to the patient what's going on, and it lets you actually ask questions. So if you don't understand something as the patient, you can then ask it to clarify that or to explain it in a different way. And so it's really a back and forth rather than kind of spitting out a bunch of data and having to, as the patient, figure out what that means.
I'm thinking Dr. Ivan Walsh, our resident psychiatrist.
And Dr. Lawson has joined and his hand is up.
Okay, is Dr. Walsh on?
He's not unmuted though.
Okay, Dr. Lawson? All our other resident psychiatrists.
Yeah, one of the issues that you're well aware of, is that AI is used in terms of conversational interactions tends to be overly supportive of the patient's position, and which came up in psychotherapy and AI, and also things like I'm going along with patients when they say, "Yeah, I want to commit suicide," and I'm just wondering what kind of guidelines you have in place for a patient. And they say, I like to. For example, I like to use this rat poison as my medicine, even though it's not approved. So, what is built in this system to prevent harm to the patient, even though the patient is tolerant of such harm? And the second question I have, two of them, is also a bunch of AI depends on the literature that's available. We found that something like 20% of a lot of psychological research is unreplicable. So what system do you have to double check to make sure that the AI is using the best possible data?
I think those are great questions, and patient safety is really of utmost importance as we move forward in this kind of brave new world of AI. And it's something that we are certainly thinking about at DRE, and I think the whole industry of AI is thinking about across all disciplines, is consumer safety and the use of AI. I'll try to tackle, I think there are a couple of questions there. I'll try to tackle them one at a time. So in terms of the documentation itself, like, for example, in the ambient listening scenario where the AI is actually listening to the conversation between the doctor and the patient, ultimately the writing of the chart notes still falls on the doctor. So it's not going to spit out some kind of like permanent record that there's no opportunity for the physician to edit. It's really like an assistant to the physician to help gather the details that might be hard to recall after an hour long, say it's a therapy session that's an hour long. Sometimes it's hard to really remember every single thing that was said. And so it's really meant to be an assist rather than take the place of physician documentation. And I use ambient listening all the time in my practice. I can say that it's about 80% accurate at capturing the details of the conversation in a correct way. And the other maybe 15 to 20% has to be adjusted. And those are things that are going to improve over time as the technology gets better and we iterate further on the technology. But still, 80% of the way there is a lot better than starting your note from scratch after you spent an hour, trying to help somebody, So it really lets us focus as doctors on what we do best and gives us just a little bit of extra help there. So that's number one. And then number two, I think you were asking about well, actually, there were kind of two parts to that question, if I recall. One has to do with like inherent bias in the technology and tools and medical research, and how that interacts with like clinical recommendations. And then the other part was patient safety. So two things. I think, to your point, this is why we don't want patients going on ChatGPT and asking for medical advice. We really need tools that are trained on medical data and medical literature, because the AI, as we all know, it wants to please you, right? So it wants to come up with an answer that's agreeable to your point of view. And so we really need the healthcare industry to have tools that are specific to healthcare, because of the unique challenges that come, with patient safety. And so that's what we're building at DRE is really like a healthcare focused AI tool, which is really what makes it so unique. And then in terms of how we train the tool, there's a variety of ways that we can leverage different resources to eliminate bias. So there are, first of all, there's the entire database of second opinion experts, which was mentioned at the beginning of this meeting, which contains all of the second opinions that are provided by real doctors, not so much like medical journal kind of scientific evidence, but really practical, real second opinion advice that's of course based on evidence-based medicine, but curated by doctors. So all of that wealth of knowledge over so many years of second opinion experts was used to train the initial large language model that is embedded within the DRE tool. So that's number one. And then number two, is that there's ways that our technology team is leveraging different types of AI and also a really broad variety of sources and different types of journals. And so we're not just going to say query JAMA or New England Journal of Medicine, but making sure that we're including journals that represent diverse populations.
Thank you. Is Dr. Walks unmuted yet? Dr. Walks?
I am unmuted. Good afternoon again. Thank you, Dr. Joy. A lot of good information. My question is, when we look at, as Dr. Maxey alluded to, particular communities, how much does this cost and who pays for it? Do we have insurance companies? Do we have local and state governments that are willing to pay for this enhanced opportunity to gather and share data and to provide optimal diagnostic work?
That's a great question. I think ultimately that is the goal, right? Is um, to design a business model that first of all demonstrates the value in cost savings associated with the tool, therefore thereby convincing payers or the government or other stakeholders in the healthcare industry to offset the cost. But right now, essentially, the tool at this point in time, it's in its most basic form is free. And really, we're at a stage where we are focusing on getting as many people to sign up for Hey Dre as possible, so that we can continue to iterate and improve the technology over time. But right now, the cost for anyone who wants to sign up is essentially free, and they can start to get some benefit from the tool. And the next level up would be like extremely affordable, similar to like any other kind of app that you can imagine downloading. So the cost is very minimal, and really the model is about scaling.
Definitely. So my question is, can you tell us something about some of the coming innovations that are happening with Dre, like looking at things like A1C and other things that might be in the works?
For sure. Yeah, so Hey Dre is really meant to be the hub and kind of the central integrator for all someone's health data. And it's essentially focused on the patient being the center of the universe, and then bringing in all the data from different sources on that particular patient. So whether that is, for example, Apple Health, whether that's your Whoop or your Oura Ring or any of those other wearable devices, Hey Dre would be able to ingest that data and then combine that with the data from electronic health record to inform health decisions. But we are working on some other innovative kind of cutting edge tools. For example, we were working with a company that, as you mentioned, is trying to measure A1C and heart rate just by kind of scanning your face. So you wouldn't require any other hardware. It would just essentially be the phone as the tool. Some of these tools that we're piloting, are still pre-FDA clearance, but this is kind of the mindset of Hey Dre, is that we want to be forward thinking and we want to put tools in the hands of people at a low cost. And we see that this is kind of where the future is going. And so that's why we're partnering even in a pilot stage with some of these companies.
Dr. Maxey, if I could jump in again, that's Dr. Walks.
Go ahead.
At the beginning of our talk today, we talked about the lack of integration of medical records. So Dr. Maxey mentioned his patient coming with all these different charts of all these different doctors. And we know that other folks are trying to do AI, remote patient monitoring, all of the things that just generate all this data. Are you all looking at how Dre will be able to do what Dr. Maxey and I are not willing to do, which is go through 45 different data sources in order to get a good idea of what's happening with our patient?
Oh, 100%. And I'm so glad you asked that question, because that's really one of the core features that is already in existence today with Hey Dre, which is the ability to integrate your electronic health records from different sources. So for example, here in San Diego, where we are located, we have several different major health systems that you're probably familiar with. We have like UCSD, so UCSD Health System. We have Scripps, we have Sharp, we have Kaiser, we have Palomar Health. And so as a patient, even me as a physician patient, I have been to probably at least 3 of these major health systems for my medical care. And all of those records are siloed at those different institutions. However, they all do offer patient portal features for those different institutions. And what Hey Dre is able to do is it's able to kind of piggyback off of the patient's right to their health data through the patient portal, and then pull that in and integrate it all in one place. And so really combining the collective medical records from all of those institutions to present a uniform picture of what's really going on in a way that's summarized and concise and easy to understand, not just for the patient to make it easy to understand, but for the doctor too, because we've all struggled with that. You know, even just sometimes getting access to the records, never mind reviewing them, can be challenging.
Could we back up a minute? We had a question in the chat that is kind of the tip of the iceberg of the whole area that it addresses. The question was the member of the audience's physician is currently using ambient listening, but her question is, does that mean that he's using AI? And I think the reason I think that's the tip of the iceberg is because really underneath all of that, from a patient's point of view, as different technologies are introduced, you've got to wonder who's listening, who's watching, where's my stuff going?
Yeah. I think that's such a good question and definitely top of mind for a lot of us as both patients and practitioners. So the answer to the direct answer to the question is, if your physician is using ambient listening, that means your physician is using AI, because the way that it works is essentially listens and hears what's happening in the conversation, which then creates a transcript. And then from the transcript, it then reorganizes all of that data in a summarized clinical note, like, for example, like a SOAP note that we're probably all familiar with. Every tool is slightly different. So sometimes the AI ambient listening will keep a record of the transcript. Sometimes the transcript is just sort of like in the background and it's not accessible, or it gets deleted. And really the remaining artifact from that conversation is just the clinical note. All of these tools that are being used in the healthcare setting should be HIPAA compliant. So we shouldn't have to worry that our data is going somewhere, you know, that our PHI is being shared. Depending on what the architecture is of the tool, it may be learning from that interaction to then inform future interactions, but not exposing an individual person's data. I hope that makes sense, or feel free to ask more questions if I didn't cover everything.
So in my office, for example, I use a scribe.
Yes.
And that's ambient listening. But also my EMR has something called Suno. So it can scribe without a human. So I've got two sources listening. So this is something that everybody's doing. But the question I have, I treat a lot of hypertension as a kidney specialist. And invariably people come in and their pressures are 150/90. And she says, but my pressure at home is 115/70. It's called white coat hypertension. So talk about how remote patient monitoring can help solve some of those problems. And does Ray look at that as something in the future?
Absolutely, yes. That is something that is on the horizon for us in the very near term, to add the capability of blood pressure monitoring using FDA-cleared devices for remote patient monitoring. And as you so astutely mentioned, and I think we've all experienced this in the office with patients, is that the blood pressure tends to be higher in the office than it is at home, and we don't want to give them too much medication so that it might bottom them out and make their blood pressure too low, because we're treating an isolated elevated blood pressure reading in the office. And so a lot of times, at least in my practice, what I do is I'll have them go home and do a blood pressure log, right? So you know, they have to manually check their blood pressure and they have to write it down and put the date and the time and all of that kind of thing. Whereas with remote patient monitoring, it takes the place of that, and essentially they have a blood pressure cuff that sends the data into the cloud, which could go into Heyday, which could be viewed by the provider. Not only that, but then those blood pressure readings could be melded and kind of viewed in the context of the rest of the patient's medical history. And so this is a great use case of how we can use modern technology to overcome some of the challenges of treatment, as you mentioned.
Thank
Dr.
you.
Lawson's hand is up.
Go ahead, Dr. Lawson.
Yeah, one of the systems I work in separates out information that's available to psychiatrists and behavioral health providers versus everybody else, because there may be sensitive information. And there's two issues. One is the one in which how do you best separate out sensitive information? For instance, the patient may talk about the victims of incest or they want to kill somebody. And how do you separate out that information, if you do, in terms of that, which it may be related to criminal activity? And this comes up heavily in terms of family therapy as well as in terms of treating substance abusers.
Well, first thing would be that what's different about Hey Dre is that the decision to share information is put in the hands of the patient, him or herself. And so the patient is really the one in the driver's seat and the one in control of their health data and can make the decision to either share that data or not. Now, there are electronic ways, to create like user level permissions within the EHR, which you may have something like this in the system that you work in, where you can actually lock the data so that it can only be viewed by certain users. And then there's also breaking the glass feature, typically, where if there's an emergency and we need to know something, we can still access the data. And so those types of user permissions can be mirrored, like with a tool like Hey Dre. But ultimately, I think like kind of the main point that I want to make is, as a patient, as a consumer of health services, I am the one that really should be the decision maker about what happens with my data. I'm the one that's in control. It's my data. Sometimes it's hard to get, but this is a tool that helps getting your own data and putting it back into your hands a lot easier.
So on the phone, on the Zoom call, we have one pediatrician and 2 psychiatrists and 1 internal medicine nephrologist. So how does Dre fit across the various disciplines that we who take care of patients fit? For example, how does it fit for Dr. Neighbor-Stevens' patients, who she is a pediatrician? I'm at the other end of the spectrum where everybody I see is 110 years old. And Dr. Lawson and Dr. Walks take care of people who need Thorazine.
Mm-hmm.
How does Dre fit into our various disciplines?
Yeah, so I think there's 2 aspects to that. So the first is just, the medical knowledge and information that the tool has been trained on is diverse across all different fields and specialties. And as we mentioned earlier in the discussion, second opinion experts was sort of the foundation for building the tool, which covers a myriad of different specialties, as I'm sure you're familiar with. And so the AI tool itself has been trained on all different specialties, and also queries all different journals and different types of medical literature. And so we're really able to leverage the very broad body of medical knowledge across all different fields of medicine. But I think the nuance really comes when we start talking about kind of the user interface and how users interact with the tool, because those different populations may have different needs in terms of how they can access the tool. And for example, pediatrics, if you have a 3-year-old, they're not going to be accessing Hey Dre. It's going to be their parent that's doing that on their behalf. And so we are able to expose the tool to the legal guardian on behalf of the child, so that a parent could use the tool to help understand what's going on with their child's health. So that's number 1. Number 2, for the older population, we do a lot of geriatrics in our practice as well, and there's kind of a wide variety of literacy in terms of using technology in the elderly population. I've got 90-year-olds that are texting and FaceTiming with their grandkids, and then I've got 90-year-olds that have really never touched a computer, and they have a flip phone, or they just still have a landline. And so it can be really broad. I think that if there's an elderly person who has difficulty with technology, a lot of times they have a son or daughter or a caregiver or someone that's helping them with their care that can also leverage that tool on their behalf. So that's number 1. And number 2 is, I think, of all the different types of technology that we ask older people to use, that they have to learn, that they may struggle with, I think making it easier by creating a summary that is something that they can understand in plain English, and also giving them tools like the blood pressure monitoring, like blood sugar monitoring, where they can do that without having to make a lot of notes and stay organized. They just have to check their blood pressure, and then they don't have to think about it after that. The data goes where it needs to go. So there's a lot of ways that we're leveraging the technology to make life easier for older adults as well.
So that raised a question you said about what about multi-language? We're in California, which used to be Mexico. What do you do for different languages other than English?
That is one of the beauties of AI. So there are open source tools now that can automatically translate into any language, and so that's actually one of the easier problems to solve for. And so we will be able to essentially at some point accommodate almost any language.
Dr.
Excellent.
Maxey, could we take just a minute to put a hypothetical situation forward? Because I'm a very concrete thinking person. So if I can understand something, I usually assume people who are abstract thinkers and all that good stuff are not having any difficulty. But this is a serious matter, and I want the message to be clear. What benefit is Hey Dre to the patient? So let's use a pediatric example.
Sure.
So this particular practitioner has been taking care of this pediatric patient ever since they were discharged from the nursery. And this child is now 2 years old, has really not had any other encounter with any other practitioner. They've been healthy, everything's been going along okay. But the mom knows that her kid at 2 should be talking. And her practitioner has not addressed that issue with her up to this point. I mean, they've done kind of high level, quickie questions, but they really haven't driven down on something that is, well, I won't say flagrantly, but certainly something that the parent would notice. So with Dre, don't laugh at me when I put this question out there, but with Dre, would the mother be able to say, "Hey Dre, does my kid have autism?"
Yes, so the mother would be able to ask that question, and what would happen is the mother would basically go into the consult section of Hey Dre, where it would have all of that medical history that you articulated of everything being fairly normal, other than maybe if there was a mention of the speech delay that might be in there already. Not sure if that was documented or not, but the mother would be able to say, "Hey Dre, I'm worried that my child has autism," and then the tool for the consult would then automatically start generating questions to ask the mother for more relevant information to help inform what kind of result it's going to come up with. So it's not going to say, yes, your kid has autism. No, your child doesn't have autism. It's going to start asking other questions about certain milestones that the child might have met or other certain behaviors that the mother might be observing to get more detail, the same way that you would in a solid clinical interview. And then it will gather all of that information by asking these sequential questions that then kind of curates a hierarchy of likelihood for different diagnoses that might be going on. And it doesn't diagnose per se, but what it does, it says these are the most likely things that could be happening, and these are some of the less likely things. And it really arms the mom then with a tool so that when she wants to go in and then talk to her pediatrician about it, she can say, I was using this Hey Dre tool, and it came up with, these 5 or 6 things that I should be asking you about, or that I should be concerned about. Can we have a conversation about that? And so what it does is it sort of gets the patient or the guardian in this case a little bit further down the path, gives them a little more knowledge and kind of support to help facilitate a more meaningful conversation with the provider.
But the provider is agnostic of this interrogation until the parent brings it up.
Correct.
Unless they're smart. So what I want to do, first of all, this has been fantastic, Dr. Evers, interacting with you and these questions. We want to do this again. But I also want to open the mic for any other audience questions that might be in the chat. Anything there, Dr. Evers Stevens?
Let's see. Well, the last question was, what can we do as a patient to obtain remote monitoring? So again, Dr. Evers, I think you might need to clarify remote monitoring versus what Hydra is.
Yeah, so as a patient, if you're a patient that's seeking remote patient monitoring, you need to find a provider who is enrolled in that program, basically, because it's initiated at the provider level. There are, of course, a myriad of FDA cleared wireless devices that you can use on your own, but if you want to have truly remote patient monitoring, it requires there to be a medical professional on the other end receiving that data. And so you need to ask your doctor, are you involved with remote patient monitoring? Is that something that you can offer me? And hopefully the answer is yes. And if not, come to us and we can try to direct you to someone that isn't involved in a program like that. So that's number one. And then was there sorry, was there a second part to that? Maybe I missed.
No, the question was, how can I get remote monitoring? But I wanted you to clarify remote monitoring.
Dre versus remote
Yes,
monitoring.
yes.
Yes. Yeah, so like in terms of the product, Hey Dre is really a consumer-facing product that you can go on the App Store and download. But remote patient monitoring is something that the physician really needs to order on behalf of the patient. So same way that you would order a medication for someone, you would order remote patient monitoring. So even though remote patient monitoring can be facilitated by the app, where if you have Hey Dre, in the near future, when we launch, say blood pressure monitoring, you will be able to use Hey Dre to do the blood pressure monitoring with your doctor. Your doctor has to still be accepting of that and enrolled in that program, and bill Medicare on your behalf for those services. So that would be, you have to initiate it in a conversation with your doctor.
Let me take a minute and open the mic for the person who introduced me to Second Opinion, Steve Krause, if he's on, and also Mohan Ananda. Can you unmute him, Simon? Steve?
Yeah, hi, Dr. Maxey. Can you hear me?
Yes, we can.
Okay. Again, thank you for this opportunity, and I really just appreciate being here. And I think all the information about Dre is being conveyed. And I don't know if you had a specific question there, but I'm happy to supplement and whatever. But Joy's doing an amazing job. So
He's done an amazing job. The thing I do want you to bring out, and if Mohan's on, he can speak too. But I want to talk about how we can make this available over the next few weeks to the listeners of Black Health Trust. And I'm going to be next week going to Puerto Rico. And I'm going to be speaking to patients and physicians. What do we have on that we can offer, and how we can make it easy for people like the doctors on this program, as well as the potential patients? How can we do that?
yeah, no, that's a great question. Thank you for that. Yeah, because as Dr. Joy mentioned, we are on a campaign to increase the user base, and we have Hey Dre, which is free, but we also have a Hey Dre Vault. So where basically our system will go out and find your records. As Dr. Joy mentioned, you have to kind of call it and say, my records are here, they're at Cedars or where they're at. But then our system will be able to go and gather your health records for that. And for that system, we have a cost to it. But right now, if we get the information through you, through the Black Health Trust, just 3 pieces of information, we have to get a name, an email address, and a phone number. And if that can go to you, Dr. Maxey, or somebody on your team, and you can provide that to our CTO, Gore, who's amazing technology, he will set all of them up with the Vault version for free. So now they get real value. That's normally a $14.99 per month offering, but for the Black Health Trust and for the next several months, 6 months, that'll be free if anybody that signs up to the Black Health Trust.
What about that symbol? They can photograph and get the app.
No, I think, are you asking about the facial diagnostics?
No, I'm asking about the I got a mental block.
The QR code?
You mean like a QR?
QR code, QR.
Yeah, that's above my pay grade about the QR code, but that we can ask Gore if that's available. But I think if we can ask Gore if he can do that. But right now, I know that if we have the information is provided, he can set that up for those that are interested as a free opportunity for people that are part of the Black Health Trust. You know, and we're looking to do that for the next like 6 months.
Excellent, excellent. So I'm going to ask my co-moderators maybe to join me later this week with a brief conference call with your staff, Gore, and you, and see how we can make this available to ourselves and to some of our other listeners that are interested in doing that.
Yeah,
Yeah.
I'd love to, you have an amazing panel of physicians. We'd love to have the physicians also be part of that and to check it out and to give us their feedback, because that's the only way we can improve and get better. And I think with regard to the questions with regard to psychiatry and psychology, that would be a really good, we've had some feedback which says it gives some amazing information, but I'd love to get that from the folks here, you know, that are bringing up the questions in that vein.
Okay, is Gore possibly on now?
I don't know if Gore's on. I didn't see him.
Well, I want to tell him that I was able to get on myself, and I had a ball. I stayed on it for hours asking a question about myself and about my patients. So I don't want him to tell anybody how dumb I am, but
You're not dumb. There's no doubt about that. It's always great every time we talk, Dr. Max. We really appreciate everything you're doing with the Black Health Trust and the amazing people you put on and the opportunity for us today. Thank you.
your co-founder of the group is also very impressive. His name is Mohan Ananda, and he is both a rocket scientist as well as an attorney. So we're in good hands as we go. And I understand he's one of the guys who designed the Iron Dome that is over Israel. Is that true?
No, I wouldn't. Well, he actually helped design the GPS, global positioning, which he predicted in 1980 would be on everybody's phone by the turn of the century. So that was Mohan. That's one of his chief accomplishments, is to develop GPS. But that's actually was used for the military, and that's been part. He didn't develop for the dome or anything, but that's been used for that. But I think Mohan is on. If he's on, maybe Mohan may want to say.
Mohan, are you on? Can you unmute Mohan Ananda, Simon? Okay. Any other things in the chat, Dr. Neighbor Stevens?
No, but Dr. Lawson has his hand up.
Dr. Lawson?
Yeah, just to let you know, one of the things I've been heavily involved in is having people properly diagnosed in primary care systems when they have mental disorders. The current system uses PHQ-9, GAS, and so forth, just miss a lot and aren't very good. We're using one IM3, which is much more accurate and much more usable. We haven't tied it into a system like yours yet, but certainly be interested in seeing if we could link it to a system like yours to see if we can get a better results in terms of not only diagnosis, but link up to appropriate treatment interventions. I understand there's several systems that are going from diagnosis to treatment, but most of them are not related to behavioral health.
That's a fantastic idea that you're mentioning. We actually got some feedback recently from a psychiatrist who used the system. He thought it was amazing, and I'd love to have a separate conversation with you and our CTO about that and see put a pilot a program. But we would welcome that opportunity. Thank you for that.
Thank you.
So we're almost at the top of our hour. Dr. Joy Evers, would you care to make final comments as we start to close our show? And it's certainly been wonderful you being with us. I hope we get to talk to you again often. Dr. Joy?
Well, thank you so much, Dr. Maxey. I just want to kind of close by saying that, as Steve mentioned, we really appreciate the opportunity to spend some time with you all. It's an exciting time in medicine. I think there's maybe a tendency for some doctors to fear the technology that's coming, for fear of us being replaced, but I really don't think that is ever going to happen. I think that technology is just going to help good doctors become better doctors. And I think it's also going to help level the playing field for our patients because it's hard for them to get access to services. And so I think, as we move forward in this brave new world of AI, having physicians such as yourselves engaged with AI tools is going to be critical to make sure that they are shaped and that they are implemented in ways that are in best service to patients and doctors alike.
And thank you so much for spending your afternoon with us and your two wonderful kids I've heard about going to college, one and the other one being 12 years old. So you got a good future ahead of you. Thank you so much, Dr. Joy.
Oh, you're so welcome. It's my pleasure.
Okay, Dr. Lawson, final comments?
Just wanted to note that I think that this discussion was good and that it hit a number of the concerns as well as the value of these kinds of systems. Early adoption of the systems without going through thoroughly to look at all not only the immediate healthcare consequences, but also the moral issues and the larger societal issues. I think it's extremely important because there's just too many great technologies that never actually make it into the public because of failure to take into account the larger, broader social, economic, and practical implications in terms of a new system.
Thank you so much. Dr. Ivan Walks.
Thank you, Dr. Maxey. Thank you, Dr. Joy. And my comment is this. We currently have doctors seeing patients and prescribing medications and prescribing other treatments. One of our biggest challenges is that the patients don't take the medicines that we prescribe. The patients don't do the exercises at home that are given to them by the physical therapist. This whole patient compliance thing is really a big deal. And the fancier we get with our technologies, the fancier we get with AI, we really have to ensure that all of the new things that we're doing are targeting our basic problem. And our basic problem is you're not the boss of me. You're not going to tell me what to do. And yes, I'm going to lie to you and tell you I'm going to take my medicine 4 times a day. Newsflash, no one does that. And so when we are trying as doctors and other providers to get information from folks and to help people do things that will help them stay healthy and get healthier, that has to be our number one problem. Patient compliance is the thing that is costing us the most money right now. And in the community that Black Health Trust targets, that is a big problem. We don't have consistent providers. We don't have consistent compliance with our patients. And what new technologies are doing is continuing to widen that health gap because the use of the new technologies in our communities with respect to patient compliance is an ongoing challenge. So I'm excited. I'm excited to work with Heydrey folks, Dr. Maxey, you, Dr. Joy, to make sure that none of our communities get left behind as we do better and we do better with these patients.
Keep left.
Thank you so much.
I-76 East.
Thank you so much, Dr. Walks. Dr. Barbara Neighbors-Stevens.
Well, my final comment is we're talking about now, we're not talking about the future. But if we think about the ramifications of now for the future, it opens up areas that haven't even been thought about. Where am I going? What am I thinking about? What I'm thinking about is Dr. Joy mentioned that she had patients who went the gamut from never touching a computer to doing social media with their grandkids. As more and more of the population is exposed to new technologies, the more they will expect that new technologies will, which will by then not be new, but that new technologies serve them in the way that Dr. Dre and others are trying, the direction that they're trying to go in. So I think it is very important that we have a lot of these conversations because we've only touched the surface of what's going on now. and help the community understand the options that they have and why they need to take advantage of those options. I'm thinking about what happened when internet was being installed in cities and there were internet deserts in cities. And I was in the presence of several conversations that alluded to, well, the Black community isn't digital. They don't use the internet. And it took the cell phone to break that down. So I think it's just critical that we take the nuggets from today, chew on them, digest them, and we need to reconvene in a few weeks.
Excellent, excellent. And for my final comment, I'm gonna first of all thank the staff of DRE and especially Dr. Joy Evers for joining us to give us this educational session about this new technology and how we can be a part of it. We thank you. And also remind everybody that this session is archived on YouTube, Facebook, and the other things that Simon has cooked up, and we can make sure everybody gets a look at it. And I want everybody to have a great Sunday afternoon. Enjoy the good weather. And I'm going to make my blackberry cobbler that's diabetic friendly. Thank you so much. Thank you to HeyDRE staff. Thank you, Simon, very much. And thank my co-moderators. Have a great Sunday.
Bye.